Welcome to Fantasy and Frames, our mental health awareness series. This is episode 7. This series will come out every Monday morning at 9 a.m. through the summer on our YouTube channel. So subscribe, hit that bell so you don't miss any episodes. We will be discussing a specific topic each episode. If you ever have any questions, please leave a comment or feel free to DM me. And I could not think of a better person to talk about mental health than an expert, my wife, Megan. So welcome. Today's topic is anger masking. So let's start with hopefully a simple question. What is masking in general?
So masking refers to the tendency someone may have to hide their emotions, behaviors, or even personality traits. There are a multitude of reasons someone may choose to hide any of these things, such as possible judgment from others or trying to meet stated expectations. Masking can become a learned behavior to cope with or hide symptoms of emotional or behavioral issues. It can become so ritualistic for a person that they may not even realize they're doing it anymore. Individuals regularly engaging in masking often feel physically fatigued and even emotionally drained due to the toll frequent masking takes on the mind and body. When you're putting on a show or a front for others, it's unnatural and requires a lot more effort.
Okay, so what is anger masking specifically, and what is the reason we are focusing on anger instead of other emotions?
Well, most behavioral masking results from personality disorders, severe mental illness, and even autism spectrum disorder. Those diagnoses require individualized therapy and are outside the realm of what we can achieve in the series. So, in regards to emotional masking, you are presenting an emotion to others, which is different from the actual emotion you are experiencing internally. This concept is widely used in antidepressant commercials. Depressed individuals are masking their sadness with fake smiles and happiness, which makes them even more depressed. However, I primarily see anger being the main presenting emotion when it comes to the problematic masking of emotions. Regardless of what someone is experiencing internally, which is typically fear of sadness, the anger is what is projected and expressed for others to witness or experience.
Okay, so last episode, I mentioned that I experienced anxiety. Honestly, I still do, but I did not realize it was anxiety. I was masking my anxiety by expressing anger. My anxiety would get triggered, and I did not know the proper coping skills to manage my anxiety cycles. It would just come across as me being an angry person. People saw my anger, but they did not see that anger was covering up my anxiety. It felt easier just to be angry than to acknowledge my true emotions because I was stuck in that social stigma that talking about showing emotions was a sign of weakness, whereas exhibiting anger was more of a false sense of strength or authority. Fortunately, I eventually went to therapy and realized I was actually experiencing anxiety, and that anger masking was not a healthy way to cope. Therapy allowed me to understand my triggers and realize that truly being in touch with your emotions is a real sign of strength.
That's a common experience I hear from my clients. You may not have been able to label your anxiety, but you knew it was something you no longer wanted to experience. Thus, you became angry and unable to change your circumstances until you achieved awareness of the actual changes you needed to make. Unfortunately, there is still a negative societal stigma against expressing emotions and valuing mental health in general. I've even noticed less acceptance for expressing emotions in traditional males or people of color. At young ages, children are trained to be tough, suck it up, or stop being a crybaby for the comfort and convenience of others. They are often sent away to work through their emotions on their own without any modeling or guidance. Having emotions is quickly learned to be a weakness that is frowned upon. However, the emotion of anger is typically considered powerful and acceptable, especially in males where the concept of peacocking and machismo is valued.
So I am sure some people may be thinking right now that it is not healthy for them to express anger. Can you address that misconception?
Anger can be a very harmful and destructive emotion, but it's also a positive and important emotion when properly harnessed and channeled. The purpose of us experiencing anger is to alert us that there is something we are not happy about, and then motivating us to make the necessary change. When you direct that motivation, and where you direct it determines a positive or negative outcome. So, for instance, when a group of mothers experiencing grief and anger from losing a child to a drunk driver who just received a fine or a slap on the wrist harness that motivation to lobbying for stricter punishments for DUIs. They made a huge impact on the prevalence of drinking and driving due to fear of legal consequences and maybe even increased moral awareness. On the flip side, if that group, Mothers Against Drunk Drivers, was actually a group of assassins to retaliate and murder the drunk drivers who took the lives of their children and other innocent lives, then I'm sure we can all agree that would be harmful and destructive use of anger. I know it sounds silly using that example, but anger retaliation is a very real and devastating problem when anger goes unchecked without proper awareness or coping skills.
Okay, so obviously anger is a powerful emotion, and it is important to understand how to keep it in check and harness it to benefit you in a healthy and productive way. How would you advise someone to explore and identify the true feelings being masked by their anger?
I like to start with awareness of the underlying emotion. In my practice, I utilize a therapeutic tool known as a feelings wheel. I also have a visual here to not only show you what a feelings wheel looks like, but also how to properly apply it. Regardless of your background and culture, research has proven that everyone experiences the universal human emotions of joy, sadness, anger, fear, and disgust. You can see those emotions alongside surprise and bad in the innermost circle. This circle is just for classification purposes. It does not give me a lot of information as to what you are feeling when you only tell me which emotional category you are experiencing. Thus, you need to branch out to the middle ring to see what resonates with the type of emotion you are experiencing within that category. That middle ring then branches out into the outermost ring, which has very detailed and specific emotions. The goal is to be able to label your emotion using the outer ring, but sometimes that can be a bit too specific. So it's okay to use the middle ring if those are more fitting to you. Now, when you look at that angry wedge, there's a wide range of possible emotions that can be considered angry. For instance, you may utilize the wheel to determine that you are feeling jealous in one situation and withdrawn in another. If you constantly communicate to others that you are angry, then they will always react the same. However, when you are able to label your emotions more specifically, then others will react differently to each emotion. For example, jealousy and withdrawn both fall within the spectrum of angry feelings, but they are fundamentally very different emotions. Being angry versus being jealous versus being withdrawn will all elicit very different interactions with others, since they will better understand your experience and possibly even express some empathy.
So it can be hard to label your emotions without a lot of practice. The feelings wheel definitely makes it easier to pinpoint that emotion. I use this in my therapy sessions early on to help me be more specific about the emotion I was feeling. As you said before, saying I feel angry is way too broad, but saying I feel annoyed gives me something to work with. I can then work through my thoughts and feelings to figure out what triggered me to feel annoyed. It can be a tedious process in the beginning, but the more you practice, the easier it will be to think about your specific feelings and trace it back to a trigger. Then you use the coping skills we discussed in earlier episodes to process that feeling in a healthy way.
Exactly. The biggest challenge is the awareness of an underlying emotion and being able to properly label that emotion. So if you think you are feeling angry, but none of the angry feelings on the wheel resonate with you, that's a huge indicator that you are anger masking. In my experience, you will most likely gravitate towards the fear and sadness wedges. When you experience fear or sadness, they are both viewed with negative stigmas even though anxiety and depression are fairly commonplace in society. They are both emotions that make us uncomfortable. Anxiety alerts us that there is a real or perceived threat against our life, which diminishes when we are able to eliminate the threat. Sadness allows us to come to terms with the situation, which diminishes when we are able to process and move on with our lives. Anxiety and depression form when you get stuck and either the threat is not able to be completely eliminated or you're not able to move on from a challenging situation. You can see how both of those situations are unpleasant and may benefit from being angry and harnessing that motivation to make a change within your circumstances. However, do not allow that anger to take over and allow you to lose sight of the emotions you are actually experiencing.
Well, thank you, Megan, for sharing so much valuable information on anger masking. Thank you all out there for joining us today. We hope you were able to get some information from this that will help you or someone you know. We will be back next Monday at 9 a.m. for episode 8 to discuss internalized shame. Again, the best way to watch this series is to subscribe to the Fantasy and Frames YouTube channel. And like I said, you can always leave a comment if you have a question, or feel free to DM me if you'd like to keep it private. If you are struggling or having suicidal thoughts, then immediately call or text 988. That is the National Suicide and Crisis Lifeline and is available 24/7. So thank you all, and we'll see you next week.